Hi there. I wrote my paper about the ethics of healthcare in a prison environment. Um, so I chose this topic um, because I was sitting around my house trying to figure out what to write about, and I was really struggling because I just couldn't find anything that I thought was particularly interesting. Uh, and so I just kind of threw the question out there, like to my boyfriend. I was like, "Hey, babe, what should I write my ethics paper about?" And he said, "Write about the ethics of healthcare at prison. I'm watching Orange Is the New Black, and they were just talking about that." And at first, I kind of blew him off, and I was like, "It's kind of a dumb idea." And then I was like thinking, it's like, that's actually a great idea. So I started doing the research and looking into it, trying to figure out what is, is there enough in there or whatever to get a paper out of. And I realized that there's so much. There's way more than I ever could have fit into one paper. So I actually ended up throwing out some things. I didn't talk about um, mental health care in prison, and I didn't talk about the role of physicians in capital punishment, like some big things that needed addressed. I just didn't go into in this paper, and we won't really talk about, even though those are there, because again, there's just way too much. Healthcare in the prison environment is a really complicated topic, especially when you're trying to think about how can we do this ethically. And so, the U.S. Supreme Court ruled that it would be cruel and unusual punishment to deny health care to people in prisons. And so we've been thinking about this for a long time. How do we address the needs of the people that we incarcerate? And it's not just the U.S. This discussion has been going on for a long time. Um, in the in 1993, the General European Committee for the Prevention of Torture set out a really nice set of guidelines that really help people to navigate these waters. And so those 7 guidelines, or 7 basic principles of ethical healthcare in prison, if you will, are access to a doctor, equivalence of care, which we'll talk about in a minute, patient's consent and confidentiality, preventative health care, humanitarian assistance, professional independence, and professional competence. And so these are all of the things that we sort of talk about while we're trying to work out an ethical way to do healthcare in the prison system and get the best quality of care to inmates. And so we're going to go over these. Obviously, the first thing is access to a doctor. Just because people are locked up doesn't mean that they don't get a doctor. One area where we really find healthcare is obviously not going to be the same in prison versus the outside world, is that you can't choose your doctor. And unfortunately, that's one of the things with that. There's no way to work around. It's just sort of a part of the prison system that we have to incorporate into our healthcare in that environment. So the second one is equivalency of care, which is a really big topic of conversation when it comes to healthcare in prisons. So equivalence means that, again, the healthcare inside of prison should be the same as it would be for anyone who is living outside of prison. But, just like I said a moment ago, you can't choose your doctor, and you can't, just decide that you need all of these extra tests. There's a lot more restrictions on what you can and can't do when you're receiving healthcare in a prison environment, and so that has been a big challenge for equivalency, and so that people are trying to figure out now is how can we sort of change the way that we define equivalency to actually mean the same thing. So what they've been trying to do is change the idea of equivalency of deliverance of healthcare to mean more of an equivalency of health outcomes. So what that means, and where it's really easy to see it, is that people in prison should be as healthy as people that are outside of prison because healthcare is as good. But this doesn't really happen. People who are in prisons get sicker sooner from the same chronic diseases. Someone in prison can expect to fall ill from a chronic condition 10 years earlier than than their counterpart who is not incarcerated. Another place we can see this is the rate of infectious diseases among prisoners. The greatest disparities in prison healthcare can be seen in the rates of substance abuse, communicable disease, such as hepatitis C, HIV, and tuberculosis. And so, if you're in prison, you're more at risk for these things. And so more needs to be done in a prison environment to treat them and to take care of them and to prevent them than usually happens in a healthcare setting outside. So a lot of work is being done in order to achieve the same sort of level of health for people who are incarcerated versus people who are living outside. So equivalency, while it hasn't really been the best principle to kind of distinguish healthcare in prisons, it has evolved a lot and has started to be more of a realistic goal and also to sort of mean something. Because you can say like healthcare is equal in prisons because they can get the same tests, they can get the same medications, all these things, but it's really not a reality, especially once you start to look at the outcomes. So by focusing on an equivalent outcome, we are having a more realistic approach to treating people in prison. So the next element of an ethical delivery of healthcare in a prison environment would be patient consent and confidentiality. But this is another area where there's a lot of problems because being in prison, you inherently have a lot less privacy and you have a lot less confidentiality. Just a really easy example is if a doctor does diagnose someone with hepatitis C, they have a responsibility to then report that to the prison authorities versus someone in the general public who had that would, those records would be confidential. Patients don't also enjoy the same level of consent that they have in the outside. They have to submit themselves to medical exams upon entrance into the prison. They have to do certain medical exams at certain times versus choosing when they would normally. And this can create a bigger problem because it can really affect the relationship between the doctor and the patient, and we're going to talk about that more in a little bit. So another thing that is on people's radars, one of the 7 principles, is professional competence and professional independence. And so these two really go hand in hand with the doctor-patient relationship, so I'm going to talk about them all together. So professional competence just means that doctors who work in prisons have to be as good as doctors who work outside of prisons. And this, is for obvious reasons. Typically, however, they're the same doctors. Someone who works in a prison environment is not going to do that exclusively. It'll be something that they do in addition to other work. There's just always sort of been an idea that only hack jobs want to work in a prison environment or whatever. And so it's really has been important for people to uphold, like, no, we are real doctors. We choose to work here for various reasons. And so the idea behind the ethical guidelines is just that they guarantee that everyone has access to a competent doctor and not just some prison quack. And then so professional independence is about the idea that doctors have to remain really loyal to the patients when they're delivering healthcare. So in a typical setting, a doctor works for the patient, right? They get money from them, they are working for them. But in a prison environment, the doctor is employed by the prison, or in some cases by the state or the country. But typically they're employed by the prison, and this can create a lot of conflicts because they will feel more of an obligation to their employer sometimes than they will to the person who needs care. and that creates problems with confidentiality again, and with trust between the doctor and the patient, which can be a huge hurdle to care if it doesn't exist. And so one of the things that's going to really make a difference for creating a more ethical healthcare in a prison environment is going to just be more funding and more doctors. And finding ways for that funding to come not from the administration of the prison, but actually a third party entity that employs these doctors, because if a doctor feels obligated to the authority that they're working for instead of to their patients, then that will cause a lot of trust issues. They can deliver a lower quality of care in order to save money, or simply the patient will not trust their doctor because they're working for the prison that is keeping them there. So it can create a lot of problems. But if there was more money to hire more healthcare professionals, there could be a division between the people who are actually delivering patient care and taking care of the day-to-day needs of the prisoners in the institution. And then there can also be medical staff who are doing more administrative things, like doing the intake evaluations and signing off that people are healthy enough to be in prison in the first place, to take urine and blood samples in the event of infection or in the event of suspected drug use. There should also be separate staff that go through medical records with consent from the patients and then report perhaps potential injuries due to violence to the prison environment, because if the general care practitioner is doing all of these things, then the patient isn't going to want to trust them. And that can cause a whole bunch of problems for delivering good health care to people. So there really needs to be this division between doctors who take care of patients and doctors who take care of the needs of the hospitals. So the last thing that I'm going to talk about is the way that the doctors can find themselves having problems delivering care in a prison environment. So there's loads of problems with overcrowding in prisons. It's one of the most common problems that I think most people would know about, but we don't usually think about how this can affect the delivery of healthcare to patients. But once you really start to analyze it, it makes sense. If there are just too many people in a prison, it can make it extremely difficult for the doctors and the nurses to simply have time to get to everyone. So that's one problem. Another problem is when there's too many inmates in one place at one time, and this makes physical barriers for the doctors to either move from place to place across the prison, or if the doctors don't feel safe because of the congregation, that can also create a problem for delivering care. Another issue is lockdowns in a prison environment. If someone needs a certain medication at a certain time, but there's also a lockdown going on, they have to wait. And that's just the way that it is. And so there needs to be some sort of way that we can address that going on, because these physical barriers cause people to fall ill. They cause people to mistrust the prison system and mistrust the doctors. And mistrust is kind of a two-sided problem within this environment, because doctors can also find themselves mistrusting their patients for various reasons, like we discussed before. Perhaps someone has been abusing the healthcare system, and so the doctor feels mistrust in that way. Or just through the grapevine of the prison environment, it's really common for doctors to learn about the crimes of their patients, but this can create a huge barrier to care, because then the doctor might have a bias against a certain patient, or they may feel unsafe with a certain patient. And so those types of trust issues are something that healthcare providers who will be working in prisons really needs to be educated on and be aware that this situation is going to arise, and they can think through that on their own beforehand about what am I going to do when I get into this situation. Whereas right now, there's not really a lot of education for healthcare providers in that aspect. And so they get into that situation, and then they're just totally caught off guard, and it ends up causing more problems. So there is a lot of work to be done to improve healthcare in the prison environment, despite how far we've come. And again, really the problem comes down to funding and to administrative problems. As long as doctors are employed by the institutions where they're working in prisons, or they're working for the state, there's going to be a conflict of interest there, which is something that we work really hard to avoid in a medical community. And as long as there's not more healthcare providers doing things in the prisons to take care of the patients and to take care of the health in the prison, then there's going to continue to be these trust issues between the patients and the doctors, which can really lead to worse health outcomes for people who are incarcerated. And so as we work towards tailoring healthcare towards the specific needs of the prison population with more preventative care and with maybe a better diet and more education, things can really start to reach a true equivalent of